This episode is brought to you by Experis. Health IT is complicated. Finding the right partner doesn't have to be. At Experis Health Solutions, we deliver the expertise you need to modernize, optimize, and innovate faster, helping you improve patient care while maintaining a healthy bottom line. From advisory and implementation to optimization and managed services, we've spent nearly 30 years partnering with over half of U.S. health systems to drive meaningful transformation. Need a single expert, a full team, a tailored solution? We've got you covered. Flexible, scalable, and designed for your success. Experis Health Solutions, fueled by passion, measured by impact. Learn more at thisweekhealth.com/Experis. Today on Newsday.
Between hospital at home and utilizing telehealth in a totally different format than we're used to, that's the way of the future for happy patients and for providers not just quitting and saying, I can't do this anymore.
I'm Sarah Richardson, a former CIO and president of This Week Health's 229 Community Development, where we are dedicated to transforming healthcare one connection at a time. Newsday discusses the breaking news in healthcare with industry experts. Now, let's jump right in. Welcome to Newsday, where we break down the top stories in healthcare IT and explore what they mean for leaders in the industry. Today, I'm joined by Margaret Ptacek, Senior Vice President at Experis, a leader in healthcare workforce solutions, clinical operations support, and technology-enabled care models. We've chatted a few times before about different aspects of what we both do, and today we get to talk about the news. And the first article we picked was the remote patient monitoring devices transforming patient monitoring and showing promise for reshaping cancer care. High level, these advancements in AI-powered RPM are making it possible to continuously track patient vitals, symptoms, and treatment responses, particularly for oncology patients. And these tools are proving effective not only for proactive interventions, but also for reducing hospital readmissions and improving quality of life outcomes. Love to hear your thoughts on this article.
No, absolutely. So really, the goal of all of this is when RPM is implemented appropriately, it's truly an extension of the health system out into the community. And that's really an impossible thing to do without a true program model. And that's what I hear a lot from our organizations is that they're trying to do it in bits and pieces, but it takes an entire program for it to be effective and to also monetize on it as well. As much as we want to be in the business of doing everything for our patients, there's obviously the business aspect too. And so you have to make sure that everything that you're doing is either reimbursable or there's a way to overcome the financial burden of it.
Well, absolutely. You consider if you're a CXO sitting in the hospital, you need a scalable model for improving outcomes post-discharge, especially in complex high-risk populations. But then also looking at that value-based reimbursement opportunity, I think about Medicare Part B and the demand for robust data integration, security, and clinician workflow alignment. And it's so much more than devices. This is something that's right in your wheelhouse.
It is. So there is a program that we have launched this year called Concierge Clinical Solutions. It really models and leverages AI powered RPM protocols that have been built in and in place for over 30 years. We have a wonderful tech partner that has been in the nurse triage space for 29 to 30 years. And so we're utilizing all of that great work that's been utilized primarily in the ambulatory space to now shift over to the acute care space. And with this program, it not only provides potential admission and discharge offload of the nurses in-house, but then we can follow those patients for 30 days post-discharge with remote patient monitoring, proactive reach outs, and proactively teaching them and training them how to be healthier patients, really to prevent that financial burden and obviously the poor patient outcomes that occur when they just don't know what to do when they get back home. So we're really proud of this clinical concierge solutions, and I think it's going to expand greatly over the course of the next several years.
Well, and I love how you call it concierge clinical solutions because that really, as templated as it may be, you also can meet your clients where they are. So whether that's outcomes, reimbursement wins, even some of the opportunities it's creating for specific clientele and patient populations, that's a win that goes beyond just what someone may have engaged with you to create in the first place.
100%. Absolutely.
I'd love to ask you though, what have you found is the biggest barrier to RPM adoption? Is it technology, workflow, culture? How do you help your clients overcome that?
So hands down, I think it's two areas. One, proving its worth, which honestly, any managed service across the board, that's always a struggle point. So coming in and really getting some good baseline data, meaning, what are your 30-day readmission numbers? What are your patient satisfaction scores? What is your nurse turnover rate? What is your provider happy standpoint, I should say? And some organizations are great about checking that or not, but really proving that what we're doing is working. And so you've got to have that baseline data and then really tracking those KPIs that we are making the impact that we came in to do. And then presenting that to the leadership so that when you say, it's working great on med surg, let's expand it to this unit, there's facts and data to prove that. So that's one, is really proving the worth of it. And then two is the reimbursement piece of it. And that does not sound as complicated as it should be, but it is actually very complicated. And so our offering is really the holistic package. We provide the pre-implementation activity of really setting up the structure of the program with those baseline data and KPI points. We then provide the nursing staff, the technology, the automated tools whenever possible. And then we actually do the code drops at the end of it so that these facilities aren't having to figure out what individual codes based off of Medicare, Medicaid are actually, coordinated with the right patient. And again, like I mentioned earlier, without the reimbursement piece of it, it's very difficult to continue to expand and find that funding and that approval for it.
Well, and that extra layer of that coding element that is already backed by the algorithms you have in place is huge because so many cuts are coming everywhere. Margins keep getting compressed. And if you have those revenue capabilities brought into an organization to do something that's about closing the loop between the hospital, the home, and the care team, and about personalized care plans and even capacity management, when you can bring all those things together in a way that's pretty seamless for the health system, they need that now more than ever. And so do the patients.
Absolutely.
Let's go to Article 2. Hackensack Meridian expands hospital at home to improve patient care statewide. So they are scaling their hospital at home model across New Jersey, allowing more patients to receive acute level care in their homes with remote monitoring, on-demand nurse visits, and virtual physician oversight. Tell me your thoughts on this one.
We definitely support this transition, and I personally have been tracking it for over 5 years. I kept thinking maybe it would move quicker than it is, but that's just healthcare. But we can really provide that by the monitoring piece, the nurse triage component, the operational framework that's needed to really do that shift safely. And then our goal really is to make sure patients are not just discharged, but they're truly supported in a way that prevents that bounce back, that readmission, and really enhances their recovery experience. I mean, the ultimate goal is obviously happy, healthy patients. And I think this really fits into that pathway well.
Absolutely. If you can alleviate the pressure on the ED and the inpatient capacity challenges that most systems experience, you have a competitive advantage with both the satisfaction and the experience of the patient. But then that high reliability that's required from the system itself and the operational coordination, that is not lost on all the elements that it takes. Now you're looking at IT plus clinical plus operational elements. I'm wondering though, when you consider how it's scalable and how safe it can be, especially with the strain on EDs and inpatient, how does Experis help an organization make that kind of a leap?
Great question. So the first step is really understanding, ensuring you have the right patients that are even opted in to this option. And so we can come in and really help with that initial framework to assess who's a good candidate and who is really better off staying in a traditional hospital setting. We can help build out that assessment, internally into their EHR system. So it's a nice workflow that's integrated already into their typical workflow. And then the second piece is utilizing our nurse triage framework that, again, has been around for many years, just to ensure that we're utilizing those well-known workflows and protocols that have worked for a long time so that there's really great oversight and a positive experience. And then lastly, again, it boils down to reimbursement. So it's going to be important for healthcare orgs and companies like Experis to really establish a strong working relationship with the payer partners. At the end of the day, we're all in for the same reasons: reduce costs and have better patient outcomes. But the level of reimbursement is not obviously going to be the same in the hospital setting as it is at home care. And so we've got to come together and figure out what does that reimbursement model look like and move forward with that.
And so much of this is predicated on the patient experience. From the
Yes.
work that you do, how does at-home acute care change the patient's perception of quality care and trust with their health system?
I think they finally feel heard in those settings. And I do think that is an ongoing issue in healthcare in general. I mean, our providers and our care staff are so tapped out right now, and they have to prioritize not just their hour, but by minute, by second. And so when that happens, the patient often feels like they can just be lost in the mix. And so in this setting, we all know sleep better, we have less stress, we're happier in our own environment. So to be able to offer all of those comforts with the comfort of knowing that there's a highly trained team proactively monitoring you, it's just a perfect pairing. And in addition, the other cool piece of that is with video calls, providers can actually visually see where the patient is staying and their environment factors of that. And that's something that's usually just verbally told, during initial visits or the intake process, but to actually visually see where they're set up in their home and the factors that can potentially cause poor outcomes, that can just add an additional layer of education and potentially preventative measures that we didn't have prior without having eyes on their environment.
And with the aging population, I want to take the lens of a future outlook. Do you believe that the hospital at home dynamic will become a standard offering for certain conditions? I say in the next 5 years, let's be honest, this next 20-year window, 11,000 people per day, and I'll be one of them within that 20-year window, aging into Medicare. Like, what do you expect from the hospital at home opportunity?
I think it's the only way that we're going to keep up with the demands of the aging population, coupled with not enough skilled caregivers going into that field. You think of the specialists and the physicians, there's just not that many choosing that option in school anymore. You think of, your own kids or your nieces, nephews, they do not want to end their career with several $100,000 in debt. They don't want to be in school that long. And so getting them to sign up for this career, we're going to have to offload some of kind of the terror factor that they hear about when they decide to become a caregiver. So my ultimate hope is that we use hospital at home and nurse triage to really create a total health plan for patients and their providers. So for example, let's just say a patient has diabetes, they have high blood pressure, they have depression. So they easily could have a primary care provider, they could have an endocrinologist, and they could have a psychologist all on their care team. Traditionally, they'd have to have 3 separate visits. Medications could be changed without, any of the other providers knowing about it. And if we could coordinate that one telehealth call with all the providers, every 6 months, we could see a drastic improvement on just the patient's outcomes and less confusion, less frustration on both parties. Documentation is great, but there's nothing like a coordinated call where everyone's hearing the same things at the same time and coming up with an approach together. So I think between hospital at home and utilizing telehealth in a totally different format than we're used to, that's the way of the future for happy patients and for providers not just quitting and saying, I can't do this anymore.
I love that perspective because I'm also hopeful that with the concern about rural closures and other things coming up, that it allows a lifeline to patients who wouldn't otherwise be able to even access some of that care, assuming, of course, their broadband can keep up with the demand. But imagine those things will come together faster than they have in the past for obvious reasons, which takes us to our third article, and that's that a new hospital that has opened is struggling with staffing shortages. It's affecting their clinical care and the operational efficiency. Leaders are citing national labor market constraints and high turnover as some of the ongoing challenges. When I put my CIO hat back on, I realize that workforce challenges remain one of the top threats to care quality, ability to staff people within those facilities. But then that's going to slow technology adoption and limit service expansion. And the adoption is the whole point of making a lot of those investments so we can continue to offer the services that are so needed. But then these creative staffing models, like what you just mentioned, and virtual augmentation to help us fill the gaps. Tell me your thoughts on this one.
Absolutely. So at Experis, we really help organizations supplement and stabilize their workforce with virtual staffing, nurse triage, clinical support solutions. And this really allows our clients to maintain that care quality keep their services running and protect their teams from burnout, even in those high demand periods, which is critical. It's the ebb and flow. I mean, we all have ebb and flow in every industry, but healthcare specifically is that way. And with that ebb and flow, I think specifically to healthcare, there's more risk involved if you don't have enough of the right staff at the right time.
Can you share in a little more depth about how your solutions are helping clients maintain quality and avoid some service disruptions from staffing shortages?
Sure. So, really, our ultimate goal is to offload time consuming tasks that don't have to be done in person. Not everything has to be done in the traditional way that healthcare is used to. So, when it's a time consuming task like admission and discharge, and you already have an understaffed provider population, I guarantee there's things being missed and rushed to the detriment of the patient. I personally, as a nurse practitioner, know that if it's finishing this med reconciliation or, running to the crash cart because a patient's crashing, you're going to go that pathway. And you don't always get to come back and finish that really important documentation that's going to lead to better care and better outcomes for that patient. So if we can come in with a team that's not being pulled away with the 5 million other activities that happen in an acute care setting and are dedicated to that patient, their charts are going to be updated perfectly. And that patient is going to feel like they have a voice to talk about their issues, their concerns, and actually get some really great teaching. So we're really trying to help reimagine what patient workflow can look like for an organization and really what has to be done by an on-site provider versus what can be offloaded with our team of virtual nurses.
And if you had to give advice to a health system in terms of workforce resilience, what would you share with them when it comes to facing chronic staffing gaps and why they would want to partner with you for that?
I think the biggest advice is you don't have to figure it out all on your own. We are your partner, and our jobs are not to try to sell you something you don't need. I mean, personally, just from my heart, I am constantly trying to figure out where are the gaps in healthcare and how can we make it not only not cost the organization, but actually increase their revenue and have happier patients and providers. That's what they need from us. So partners like us can get creative to really ensure that what's working well stays that way, and that what areas can be more efficient and with better outcomes through outsourcing can be shifted to that model. And it's really that program level that I talked about earlier that we can provide that's key. Trying to launch RPM, chronic care management, hospital at home, outsourcing admissions and discharges can seem completely overwhelming for most organizations. And oftentimes it's hit and miss. They're doing pieces and components of it, but it's not a holistic program. And so we can come in, set that up, and be monitoring it 24/7. And it's our job to make sure that it's going well and really offload that struggle point and that risk factor by trying to fix it all on your own.
When I was a CIO, I always appreciated partners that could come in and do program management with me. Like, here's the 4 or 5 things we need to tackle. It is one bucket of work. You've got your team, I've got mine, and they work seamlessly together to deliver all kinds of amazing opportunities inside the system. And often you'd find things that neither of you had expected that make things even better because of that. What's unique about all 3 of these stories is that technology and people are absolutely intertwined. How do you see Experis blending these 2 elements to deliver a sustainable solution? And I'll do like what I call the Sarah math, which is always kind of fascinating. 80% of all of this is people related. That process and the technology might be 20% of the equation. So if 80% is the human factor, how do you bring that forward so that it lasts beyond the implementation phase?
Love that question. So there's always going to be that high people touch area. And that's honestly the core of healthcare. There's always got to be the people component of it. But there's multiple areas that AI and automation are actually going to provide better care by removing the people error. And that's really what we're starting to build out. We don't have all the answers yet. I don't think anyone has all the answers yet from AI and automation and how do you intertwine that perfectly. But I personally, and then just Experis and Manpower Group as a whole, we're collaborating as a company very strongly to figure out what's working well in certain industries that might be, several years ahead of where healthcare is at. And how can we incorporate some of those best practices that can be infiltrated into healthcare And that's really my job and Experis's job, is to come up with those newer solutions, but with proven track records of workflows that we can incorporate in and make this just an easier transition as we're all trying to figure out what really can be done by AI without the risk of losing that people touch.
And as a partner and a clinician, if you had to pick one capability that you believe is going to be mission critical for health systems over the next 12 months, what would it be?
So I think the key to that is offload what you can to keep the critical talent within your organization happy, because it is very difficult to find and retain great talent. Keep them happy, and then that's just a financial burden that you don't even need to figure out, as well as ensure you're capturing all potential revenue through reimbursement. Right now, every dollar matters. And what I hear over and over as I'm talking to organizations is there's just still a lot of mishaps on billing appropriately so that the reimbursement is coming in. And so we can come in, really assess that between ERP, supply chain, clinical concierge solutions, chronic care management, remote patient monitoring. We can look at it from a very holistic global picture and say, you're not able to capture all of the revenue because you're just not dropping all of the codes that you need to. Let's offload that piece so that we can keep you financially strong so that you can do all of these big initiatives that are important to your patients and the population that you're serving.
And as literally a CIO who spent probably 30 years arm wrestling with my CFOs over are you an expense, are you revenue producing, et cetera, how poignant it is at this point to be able to truly streamline operations and technology to bring the right revenue reimbursement opportunities into your health system. I'm so grateful that you shared that capability. People listening or want to know where they can go to learn more about this, how do you want people to reach out to you?
Absolutely. Well, I would love for them to connect on LinkedIn, and then they can just reach out to me personally through my email that I'm sure will be posted with this.
Absolutely. And today's stories, from AI-powered RPM to hospital at home and workforce resilience, they show a common theme. Healthcare leaders need integrated solutions that combine technology, operational expertise, and workforce stability. Experis is helping organizations make these shifts safely, efficiently, and with measurable results. Margaret, thank you for joining me today and for sharing how Experis is addressing some of healthcare's biggest challenges head on.
It was my pleasure, Sarah. Thank you for having me.
Thanks for listening to Newsday. A lot's happening in our industry. And while Newsday covers interesting stuff, another way to stay informed is by subscribing to our Daily Insights email, which delivers expertly curated health IT news straight to your inbox. Sign up at thisweekhealth.com/news. Thanks for listening. That's all for now.